your baby is swimming in the waters of your body's chemicals your entire pregnancy.
Exactly.
It's easy to understand that if I were to take cocaine while I had my baby in my belly, you'd be like, oh, you're sharing that drug.
Yeah.
But if I'm just thinking terrifying thoughts of an impending delivery, my body is creating a chemical cocktail, and it's going through the entire thing. Welcome. We are so glad you're here. If you are a woman considering getting pregnant, if you're currently pregnant, or if you ever have had any number of babies in your uterus, you're going to want to lean in. Today we are introducing a phenomenal doula and spiritual worker. She has delivered so many babies standing by these women's side. We are going to talk all things birth prep, from the wild woo-woo side to the scientific, physical aspects. We're so glad you're here. Welcome to the Painless Pregnancy Podcast. Jen, welcome.
Hi.
I'm so thrilled you're here.
I'm so happy to be here.
I have been a fan of yours, and I have loved you for years.
I think it was love at first sight.
It was love at first sight. I agree. And so what more natural way to introduce our audience to doulahood and delivery prep from the eyes of a doula than to have you here. So thank you. You mean so much to me.
Me too.
Good. So if you could just introduce yourself, let everyone know who you are and what you do.
Thank you so much. I'm so happy to be here. My name is Jennifer Radnay, and I am a holistic doula in South Florida. And holistic is about not just the physical, but the spiritual, and looking at the whole person and really individualizing and customizing what you need from preconception through gestation and into postpartum.
I love that. And do you have like a number about how many births have you been with?
Oh, how many births? I don't know. I'm one of those people, I think authentically, when I tell my clients, my families, to be in this space where numbers don't matter and time doesn't matter. I'm kind of authentically one of those people. So I honestly haven't counted.
Oh, that makes sense. How long have you been doing this?
Almost 10 years.
I thought so.
Yeah.
Yes. Yeah. That's incredible.
Just had one of my families call me that she's expecting with her third together. And I'm in like this really juicy, yummy phase of my mom's having their second babies.
Yeah. I love that. So special.
Yeah.
So special. Well, we're thrilled that you are here.
Thank you.
So we are going to be talking about all things birth prep. So a lot of people don't even know that. Well, first, what a doula is. So I'll still get the question from some of my clients, what is the difference between a doula and a midwife? So maybe if you could speak to that a little bit and then talk specifically about the aspects of what you do as a doula.
Perfect. So a doula is literally a woman who supports other women. And it's a very intimate, personal relationship, very different from what your doctor or your midwife would be, because they represent your medical care, which is very important and significant. But then who supports you as a mother, a sister, a girlfriend, in all of those places and models all of that. We really learn through example a lot also. So it's an honor to step into these lives, sometimes as their girlfriend, sometimes as a maternal figure, and guide them from a spiritual point of view and from a physical point of view.
Absolutely. Yeah, I love that. When we were expecting our second, I remember telling my husband, I really think I want a doula. Because with my first, I had a very medical intervention hospital birth. And not only did I not have the outcome I wanted, but I experienced what it feels like to be a woman in labor, and you feel like all these things are happening around you and to you. And you have your own thoughts and your intuitions while you're going through this process. And there literally was no avenue, no moment, no offer for me to speak up and be like, I feel like I want this, Like I even remember telling one of the nurses, they had propped me on one side for some reason, and I said, I feel like I need to go to the other side. And she said, we really want you to be on your left side. I was like, dear God, I can't even roll over. Like, what is happening?
One of my clients, I remember after kind of unraveling, it was her second pregnancy that she'd come for support, and we were going for a VBAC, which is a vaginal birth after cesarean. And when we really wield it back, it's about perspective, birth trauma. It's not physically what happens to you. Because I can have two women that physically the same thing happened, but it's how you internalized it and your perspective on it that can make it traumatic. And for her, it was not drinking water.
Oh, wow.
That
really
what it came down to. And the way that I try to do that is we go through a process of telling your story, but then stopping and having a conversation. And what was the emotional correlate? And how do you think that felt in your body? What happened next for you to really, truly understand? So, sometimes I'm putting on the hat of a coach and sometimes a girlfriend and really holding that space for them to understand. And it's so significant being seen and heard and really being able to process what's happening in the moment. For me also, much like all the women that I speak to that have already had children, they say that their first experience, no one guided them as to where they went. It's such a transcendental experience.
Yeah.
And we're really having this out-of-body experience in so many different ways, and someone to ground you and hold that space for you, like the significance of the umbilical cord. And then they say energetically, we all have this silver energetic cord that ties us to spirit and to earth. And it's very much about that. It's having this outer body experience and coming back with your baby. And we need to be grounded. We need to be seen. We need to be witnessed and process that happens.
Yeah, it's such a good point. It's funny. I remember when you spoke to, you came to one of the meetings and all of the physical therapists that work with me were there, and you were explaining this process, and I was just in awe. Because not only is this an aspect of birth that very few people acknowledge, but I just, like, you were speaking my story. And I was like, wait, I left my body. I don't remember my first birth leaving my body. I probably did a couple of times. But when I was laboring with Mariela 6 years ago, I remember I must have been in transition because this contraction hit me that felt like the devil went up into my body and shook my soul. It was so horrific.
That's transition. That was complete.
Right? I remember having the thought, I'm out. I'm not going to do one more.
Yeah.
And I was laying on my side when that hit me. I remember Michael was standing kind of like right where you are. And I'm telling you, like, I went in that corner.
Yeah.
And I don't remember what happened next.
Yeah.
Next thing I remember was laying on my back and being ready to push. But when you said that, when you were like, you leave and get your baby, I mean, for sure, especially through, my category of education, it sounded strange, sounds woo-woo, but at the same time, I really recognized it. Yeah, like I could resonate with that concept. So maybe if we could back up, if you could share your theory, and again, you had said maybe this is something you've pulled together from your teachings, or truly it's just come from you, from your experience, but how the trimesters go through our bodies. I just think it's so cool.
It's definitely my own experience over the years, and I think that my own birth experience, there was nobody to communicate it and validate it, and I felt like for 20 years I was in the dark, and truly I went into this seeking out those answers for myself. And then over the years, just witnessing, I had a dream that, and it wasn't a dream. Now I really feel like it was my soul having connected with my son. And when I woke up in the morning, and I was young, and we were not ready to have kids, and it was not in our plan. And I woke up in the morning, and I was crying, and I had felt what it felt like to connect and merge as one with my son's soul. And I couldn't even verbalize it. And I just turned to my husband and I was like, I need to get pregnant now. Because the feeling of being with him, it pained me on every cell of my being to not feel him within me.
Wow, I didn't know that.
Yeah, so there's everybody has a different experience, but
Yeah.
if you really sit in meditation and you sit with yourself, there is a sixth sense of knowing when that spirit comes to you. And there are spirit babies, which is one of my favorite books, which kind of talks about that. It's even referenced biblically in the Bible about the soul contracts and the soul choosing the mother and the father.
Really?
So for me, I see it like an awakening. And when you move down your chakra system, that's your first chakra. And you have this opening and this awakening for that energy to merge. And then we know throughout those 10 months, that's truly the only time that you're completely symbiotic.
Yeah.
Once we do cut that umbilical cord, again, that ethereal bond between the two of you, we may continue on feeling that energetically, but physically it's severed afterwards. But physically, we are completely merged. But they're separate as well because they haven't entered Earthside. So
Right.
the soul is kind of there. As it enters, what I see through the trimesters, that each trimester really has a different place energetically. So there's a lot of head space as the soul's moving through. And it's awakening you, and you're asking questions. And then what I see as it moves through the throat chakra, there's a lot of trying to release that throat chakra. So we see a lot of morning sickness.
Yeah.
We see a lot of vomiting. And that's that energetic and physical merging together. What's happening? You're trying to open this up. Then as we move into the second trimester, it's very much heart space.
Yeah.
And that's where we say, second trimester is usually full of love and joy. You start feeling the baby move in your belly, and it starts feeling real, and that's our happy spot.
Yeah.
Really, I mean, every single mother that I've supported, the most wow, loving, excited texts and phone calls I get is when they start to feel that baby move.
Yeah.
And that moment of merging that reality together. And then that third trimester is when it's really pushing down on identity, your sacral chakra, and you're feeling all of those shifts. And then finally it needs to emerge, and we need to release this. And that's part of we call the birth portal opening. And it's the energetic we might be talking about, but on a physical level, that is our cervix that's going to be opening and releasing this and releasing the baby physically, earthside. So that's just a theory of, probably because I had been such a devout yogi, and that's what had opened me and awakened me into spirituality and understanding, and really awakened that healer side of me that I've merged with being a doula and holding space, and just merging the two together and what I witness.
I love that. And isn't the pelvic floor another chakra, right?
Yeah, well, it's all that sacral space,
Yeah, okay.
And sense of identity. And it's really, I mean, when we look at it, they all kind of overlap each other.
Okay.
Energetically. You know, we're going through phases and we're merging into it. So I would call that whole womb space.
Yeah. We use that phrase too.
Yeah.
You're connecting to your womb space.
To your womb space, yeah.
I love that. It's so interesting to us because as physical therapists, my team and I, we take a very holistic approach as well. So for our birth prep sessions that we start around like 35-ish weeks, we work on the base of their head. We release their jaw and mouth muscles, because not only, like, we know you need to be able to vocalize during birth. And if you can make those deep, low sounds, it not only relaxes the jaw and does that downward motion at your throat muscles, but it does the same for your pelvic floor.
The energy is flowing down your spine.
Ooh.
So as the energy flows down your spine, when we feel the vibration here, we can do the exercise. If you feel the vibration here and you hum and you hold as well, you can feel the actual vibration flowing all the way through you and all the way down you. So that's why it's really important also, not only to open that throat chakra, but when you hum or sing or moan or, sometimes even scream. But that's why we do a lot of directing when the woman's in labor and she's opening her throat, to direct that energy down. We do a lot of visualizations and reminding, bring that energy down, because the larynx and the throat, as it vibrates, if you look at it, it's the same structural.
So cool.
And they're portals.
Yeah, that's a really good point.
Yeah.
Yeah. I love that you said that. Honestly, I never even put it together that a person could self-palpate your throat and your pelvic floor. Yeah. Because when we do the internal work during delivery prep sessions, so I'll have a single gloved finger intravaginally, and I'm cueing her to attempt a bulge or like a bearing down. Mm-hmm. And if they don't, I'll say, think to do it, and like give me a low hum, and I'll feel her push down better.
And can I say that in of itself is my selling point. I tell all of my clients, this is because they're like, well, I go to the chiropractor because I'm big on birth team. I want that model of we don't do it alone. Yeah. And that's what I love about working with chiropractors and pelvic floor therapists and acupuncturists, and really using all of these modalities of self-care.
Right.
And when I suggest pelvic floor therapy and the importance, understanding that you do something exclusively that is so valuable for my clients and for my families to be able to make that connection and to go inside the pelvic floor. The fear comes so heavily from the unknown.
Yes.
So for you to be able to give them that moment of a rehearsal of this is what it's going to be like is just so valuable that no one else can really replace.
I agree. I completely agree. And I think, now I don't know if you would agree, but I see a trend of women doing a better job speaking up for themselves when they feel like there's a gap or they're fearful or they don't understand something. They are more likely to speak up than honestly I was 13 years ago when I had my son. And for sure, my mom, my grandmother, they did not. It was not
What do you
proper.
think why?
It's a great question. I'm curious if the availability of information helps, right? We can both remember when doctors were parallel to God and they had the answers and nobody else and nothing else did.
Yeah.
Unless you had access to the encyclopedia, you didn't know why you were having certain symptoms. You had to wait, go to the doctor, and they would tell you what was true with your body.
Well, that's why podcasts and social media really are a gift, because it can be so informative, and you can be directional with, I resonate and I value and I respect what this person's saying, so I'm going to continue to listen. I think that that's super empowering, is that we can self-educate. So I do think that it's really exciting. And that's what also excites me about working with these families, because there really are all of these different ways for these women to step into their power, to step into motherhood powerfully.
Absolutely. I love that. And I think too, speaking of generations before us, how many categories of problems occur during pregnancy? How many categories of interventions, complications can happen during a delivery? And how many pathologies, pains, dysfunctions postpartum? This season is ripe for change and potential. Yeah. And so until now, we've just been seeing what's going to happen. What's the outcome? Okay, let's see what we can do to fix it.
Yes.
And there's really this shift in the community at large of, what can I do to prevent it?
Exactly.
Right?
Absolutely. I'm really excited about preconception and doing it consciously.
Yeah.
I think that right now, this new generation and this it's very exciting, because these women are, because they have access to so much information, empowering themselves, and they're recognizing we don't just want to conceive. And side note, there is a big fertility crisis, but it's not just falling on the women, it's recognizing the men also.
Yeah. Yep.
And women, that's part of the divine feminine, and being in your maternal phase is taking care of everybody and having a holistic family. You got to start by educating yourself.
Yep.
So these women are educating themselves, and it's starting from before they even get pregnant. They don't just want to get pregnant, they want healthy happy super babies.
Yeah.
So it's not just about, oh, I can get pregnant, but now we're seeing so many allergies and just different things that are coming up, even in my families that are very holistic. They're asking the questions. Yeah. So it goes back to detoxing the parents early on. We don't want to we want to thrive afterwards.
Yeah. I think that is a good point too, is that we're not only trending away from helping a disastrous situation, but preventing disasters or problems and also thriving.
Yeah.
Like, what's the maximum my body can do?
Yeah. I think we're healing so much from trauma right now.
Yes.
And so it's looking and saying, okay, she's healing from trauma. This is what she did. How about I learn from that and I start taking those steps physically, emotionally, and doing that work beforehand so we don't ever have to have that trauma and pass that along to our babies and our children as well.
Absolutely. 100%. Yeah. It's interesting because we shared a patient who, when she first came to us, that was her phrase. She was like, I want to do birth prep so that I have as little trauma as possible.
Yes.
And it was like probably the third visit. You know, you want to build rapport and trust and establish that foundation with your new clients. I finally said to her, what if you don't have any trauma at all? Like, what if this is one of your best experiences in this life? Like, could we, do you feel okay even considering that? And it was like mind-blowing to her. She really held on to like as little trauma as possible. Please don't beat me up too bad. And it was like, what if we just
let that go?
Yeah.
How powerful to let that go and to really rewrite our own story. And I think that a lot of times that's the downside to social media, is that there's an abundance of information. One of the tricks that I tell my families to do is sit with it. I'm not telling you to get off social media. It can be a really positive tool, but sit with it and ask yourself, what is mine and what is not mine?
Yes.
And maybe I don't need this. Maybe I want to leave this here and I want to not follow this anymore. How did that feel in my body?
Yeah.
And to start reframing, and it's truly, we're living in a matrix. So you're rewiring your algorithm so that it's positive. And she probably had heard and been imprinted from other people, possibly sometimes it's even from our own birth. If we come through and we came through in a traumatic way, then we're going to hold that energy and been raised in that way with that reflection on childbirth, that it's traumatic for everyone.
Right. Absolutely. The other thing that I've seen is when these women, I think when they start to feel supported in that, at that level, and when they confront, say, like a limiting belief, like birth has to be some component of traumatic, their tissues change. Like their whole physicality can finally melt. Like if she's allowing her mind to open space for, oh my gosh, I could be okay with this, or I could have a wonderful experience with this. Like if she starts
get
to
excited.
say that, I mean,
I use their vulnerability of being one with child and explaining to them that everything that they're feeling, their child's feeling. So mindset is everything, and managing your energy. So I do a lot of energy work, and I will do crystal bowls and tuning forks and everything, because it really does. We see the difference on how it puts us into a parasympathetic, and we want to be open, and we want to be open on an energetic and a physical level. Absolutely.
Yeah, we have I would use the word protocol. It's like a framework for our birth prep sessions. And step 1 is to calm the nervous system.
Absolutely.
We've got a ton of physical strategies to do that, but it's like I was sharing in another conversation that one of my mentors uses this phrase, and I love it. You can't make it happen, but you can make it welcome. And so we can cue her through some diaphragmatic breathing or some body connection in each phase. I've had women, typically I'm doing suboccipital release while I'm talking her through some relaxation process. So that means my fingers are up at the base of her head. Typically she's laying on her back. I'll make sure she's comfortable, pillow under the knees. Most of the time, when I'm in 2 minutes into this process, her head is like 10 pounds heavier in my hands.
Yeah.
And you see
Can
the
we do
whole
that after?
body. We should line us up. You see almost like you can witness the body surrender into the mat.
Yeah.
And it's so fascinating. Sometimes I'll ask, like, did you picture something while you were connecting with your womb space? Or what did it feel like to go through that relaxation? And most of the time they'll have this fun story to share or a visualization that they experienced. Every once in a while, we'll get someone to say, I saw nothing. I felt nothing. And I'm so curious about that. I don't know if you've experienced this, like, I want to call it a subtle resistance to connecting to your body. But to me, it's like
Absolutely.
an unprocessed trauma. Like, they don't feel
Absolutely.
safe going
Absolutely.
deep, and they might not know why.
Yeah.
But like, it's like no, can we move on? Stretch my legs.
I think that the advantage that I have when I start early on, as early as preconception, is really being able to get to know these families and what's going on, and really sitting as a girlfriend and having these conversations and holding that space. It's a build up to get to them trusting me and opening up to me, and I don't expect it. Like, wham, bam, I'm just going to show up and you're going to be able to any of it. And we use those 10 months, and they have the opportunity over 10 months to use different techniques. And what I love about them learning over those 10 months how to get themselves in a positive mindset and what works for them, these are tools that they're going to take into motherhood. And that's what we're seeing in this next generation and bubble of moms that we work with now, and we see the effects of how they're raising their kids, is we're genuinely teaching them about their nervous system, about healing, about sitting with themselves, and tools. So I don't give them all one thing to do. It might be a vision board, or it might be journaling, or it might be meditation, or it might be guided meditations, or it might be coloring, it might be speaking in the mirror. They're all different ways to start uncovering and releasing, but them also understanding that that's a final release. The whole culmination is going to be at birth. And I don't lie to them. I tell them it's going to be hard work, and that out of amazing hard work comes the reward afterwards, and that it might be heightened sensations and even painful and confrontational, but it shouldn't be fearful, and you shouldn't be suffering. And that delineation between suffering and painful is really empowering, and shifts it from, I had a really hard birth and I'm effing superwoman. And I'll even try to take these like raw pictures of my moms when they're like, because like they see themselves afterwards, and it's super validating. It's like, I went there. Yes, I did that. And I'm like, and you know what? It's going to be harder when they throw a tantrum in Target.
Right.
Like, you need this resilience.
You need strength.
You need this
Motherhood
strength.
Is no joke.
Motherhood's going to be a whole journey, and it's just the beginning. You're just opening that door when that portal and you walk through into motherhood.
So true.
But that's also why second babies, it's not the same thing. That first experience is sometimes so much more profound. Because there's so much to work through. And then that second one, we don't have as much fear because there isn't as much unknown. We can have that mind-body connection so much more. Plus, of course, there's the muscle memory that happens afterwards. But it's so empowering. And I have to also say, sometimes it's my second moms that are like, okay, wait a second, I get it. I need the pelvic floor therapy. I deserve all the ways of self-care that are going to have me thrive through this experience, because me thriving is my children thriving and my family thriving.
Yes. When we talk about how many measures we'll go through to make sure our kids are well, that they're comfortable, that they're fed, that they're sleeping, like, we will climb mountains. We will blow down walls for our kids. So to bring that back and say, your baby is swimming in the waters of your body's chemicals your entire pregnancy. It's easy to understand that if I were to take cocaine while I had my baby in my belly, you'd be like, oh, you're sharing that drug. But if I'm just thinking terrifying thoughts of an impending delivery,
Exactly.
my body is creating
Exactly.
a chemical cocktail, and it's going through the entire thing.
Well, and they're in water. And that's why I use the example. And sometimes it seems really woo-woo when I pull out a tuning fork. But
Right.
when they understand and they actually experience it, and then I say, okay, the way that you shifted from sympathetic to parasympathetic, which means from fight or flight to rest and restore, and you could feel exactly what you're talking about as you're working on them, and their vagus
Yeah.
nerve can just unravel. That shift magically, it's like, now let's take a moment when I tell you you should just start with 3 minutes of meditation and put a hand on your heart and a hand on your womb, and maybe it's hum and sing and feel the vibrations and know that your baby's in water and what a carrier frequency it is. And understanding they're not thinking thoughts. They don't understand anything.
Right, yeah.
They're with every cell in their bodies, their energy and frequency. So
Yes.
it matters so much more our state of being when we're pregnant, because that's really all there is for them.
Right, right. So let's share some stories about who we have worked with and what their outcomes have been.
I think you're at the point where you work with most of my clients, but, and I'm grateful for it, and they're grateful for it.
Yeah.
Because I'm very authentic, and when I get positive feedback, then
Right.
I can, authentically use that. The one that comes to mind that she has, we should share this picture afterwards because it's the most phenomenal picture. She basically had the baby super quickly. Like she just went into precipitous birth. Everything opened and unraveled, and she wound up not having time to open the birth pool, and she wanted water. So she wound up on all fours with the midwife picking up, catching the baby behind her because she was on all fours in the shower of the hospital.
Yeah.
It was so powerful, but. That day, we had the idea that we wanted to experience each other's birth prep.
Yep.
And I wanted to see exactly what the birth prep was. And I had invited you to my house, and we had both of those back to back.
Yeah.
And she wound up, by the time I had finished with her and you'd worked with her earlier on, she had started to feel that we'd opened everything.
Yep.
We had released everything, physically, emotionally, spiritually. And I was like, are you sure you can drive home? And she's like, oh, it must be really early on. It's my first baby. And just feeling a sense of it. There weren't really any contractions yet. Anyway, she wound up getting home, grabbing her things, driving directly to the hospital.
Wow.
Had the baby. I don't remember, but it was like maybe in 2 hours.
Oh my
that
gosh,
she got
that
into
is
the
fast.
hospital. It was very, very, and it was wonderful, and it was empowering, and it was raw. But I love that we tag teamed.
Yeah.
And it was so complete to her.
Right.
And I think that that's what's so beautiful about the synchronicity of the way that I do birth prep and the way that you do birth prep is so different.
Right.
But they come together so beautifully to complete that process for our families, for our mothers.
Absolutely. And it's, I tend to, I don't want to say hesitate, but for me, when I share stories of births that happen quickly with no tearing, where the moms are like, look at me go, I freaking did it. I don't know if it's just because what my experiences were, but I feel for the mom who's like, well, I did birth prep or I had a doula and I had these outcomes that I didn't like. Mm-hmm. I think though, Jen, I'm in a place where I can absolutely empathize with those moms because I was one. Mm-hmm. Like both births, even the second one, I had a tremendous team. I felt so supported. I was still traumatized. Like it was a tough pushing phase. My baby was in the NICU. Like things happened that I didn't want. Mm-hmm. I do think though that I don't want to hesitate to share the success stories because I'm curious if we continue to tell women we've had 10 births this week with no tearing, with minimal intervention, and she felt empowered afterwards. Yeah. Like if we can continue to share that story, I think it will shift how our moms come to us. Yeah. And less of them are going to be like, please make sure I don't have trauma.
Yes, absolutely.
And more of them are going to say, partner with me, teach me the things about my body, do the body work, do the spiritual releasing. I'm in it. I'm ready for it.
I think we have to reframe it that there's no guarantee. I always say that birth is inherently unpredictable. Yes. And I also believe that sometimes, just like I know better from having raised 3 children, that I wish I could protect them from everything,
Yes.
but I can't.
Yes.
And I think over the years, really looking at them, I say I'm not a helicopter mom either, and I'm not going to helicopter you.
Right.
There's so much wiggle room for what we can suggest and what we do with them and what they actually we all need certain life experiences. If you hadn't had that first experience, would you have sought out and grown and sought out the knowledge that you acquired in your second experience?
No.
Probably not. And I think it's just accepting that that's a part of life.
Right, right. I agree. So like essentially saying that for these women who don't have the outcome that they believe they wanted in their heart of hearts, that experience could be a curriculum for them to evolve to the next phase.
So much growth.
Yeah.
So much growth comes from it. And that's where, birth is going to be powerful and it's going to be uncomfortable and we're going to grow from it.
Yeah.
And that's really very, very intimately different for every family. But that's why the importance of education and having powerful, compassionate women around you, and a good community around you, and sharing our stories. One of the things that I love to do is prenatal yoga and the ceremonial work and the women's circles and stuff, because I've seen more and more, the more I do it, the more I see the magic and the power of bringing these women together and them talking to each other and sharing their stories with each other and learning from each other.
I love
and
that.
I think that that's part of understanding as a mother, we can't control. Things are going to happen to our children also. And we have to start parenting from a place also of giving them that space for growth and to make mistakes and learn from their mistakes. So why do we think that everything needs to be perfect? And when we attach too much to my birth needs to be perfect, you're attaching to motherhood needs to be perfect.
Oof.
And there is no such thing.
Disaster in the making.
Yeah, there is no such thing.
Yeah.
So I think that with all love and compassion, let's not victimize ourselves. Even when we do have a negative, when we have a challenging birth experience. And reframe it that we aren't victims. It's still a mind-blowing, absolute honor and unbelievable that women can create life and birth. It's unbelievable.
Absolutely. Yes.
And I think that also, like, social media portrays things a certain way. So now it's like cool. You get the holistic doula and you give birth in water with the lights and the flowers and you're just humming and all of that. And I've had clients that literally it looked like that, but I know where we went. And I come afterwards, and we always do this in postpartum. There's this transition and this integration where we really sit and talk about what went through. And I even invite them to set up a camera so that they always have afterwards a real raw birth story that they can share and they can go back to. And it's part of the process for them. But it's about how much we learn in it.
Yes. It is. It's such a powerful event, and it's a gift. I mean, any woman knows, you feel it in every cell of your body when you conceive. It's a pleasure, and it's a privilege to do that journey.
So it's not about what it looks like, but it's how it feels. So my birth prep is so much about that mindset. It's about the energetics of it and allowing it to happen to us, and allowing it to just take over for us. And not holding on tight, not being attached to an outcome. And that also will shift our perspective also.
Yes, I love that idea of surrendering the outcome and knowing that you've done what you can to prepare yourself, and you allow
But also rest. What's beautiful is that comes afterwards. We're able to be in that space after we have done the work to also physically drop into our bodies. Which is so important. Which is beautiful, because you go in there and you help them release things that they can't release on their own. Even when I'm doing the prenatal yoga and we're doing all of the other body work for them to drop into their bodies, there's a certain mergence of it as well.
Absolutely. Okay, so it sounds like you use the tuning fork to help women to connect to like a certain vibration in themselves. Okay.
Though that's one of the modalities, but there's so much that we do. I actually go through with them. I have a holistic birth prep that I do with them. And it's about self-directed, which is connecting to your body in different modalities. And there's going to be provider. And I have there, like, it's very important that you use those tools. Get the prenatal massage, get the PT, the pelvic floor, acupuncture. There's going to be different ways to access it. So it's not just about the energetics. It's really about the whole experience of dropping into our bodies and the mindset also.
Well, I think it's so interesting when I have conversations with you about the energetics, because as a physical therapist, I mean, most of the therapists that work with me, and myself included, we've all trained with Lynn Schulte from the Institute of Birth Healing. And she brought this concept of us being able to not only acknowledge the energy in tissues, but to treat and release the trauma stored in tissues.
Absolutely.
And it like opened up this world to us as PTs, where before Lynn, if we had, say, a pelvic floor that just wouldn't release, and we're doing the pressure points and we're doing the bone mobilizations and the soft tissue work and the fascial moves, and that muscle is stuck, it's tight, we could come to a place before where we were out of tools and we were like, I don't know what else. Maybe time, maybe we just need different positions. Like, I don't know what else.
Trauma. Usually it's trauma.
And now we know that we can just sit there and say, hey, this pelvic floor muscle, it just needs to be heard.
Yeah.
Like, I'm going to invite you to imagine that you're dropping into your womb space and you're walking around your like your little tiny Jen, and you're walking around your pelvic bowl and you look down and you see your pelvic floor down there. It's calling your attention. Can you witness it for a moment? Like, can you just be there? And 7 years ago, those words, I would have been like, I don't know what you're talking about. Are you asking me to go inside? Like, do you need a microscope, like an ultrasound? What is happening? Where now I'm like, oh yeah, let's go. And I close my eyes and I can drop into my body and I can picture in my mind's eye. And not only can I picture in my mind's eye, but I can also appreciate this extra level of experience of almost like seeing from my womb space, which I'm saying the words and I think it sounds weird, but I can see, like I can realize, oh, I'm in my head with pictures. No, let me be here.
Yeah.
And when you own the fact that that's your power center.
Exactly.
Oh my gosh.
It's our center of identity. It's who we are. It's our power center. I do a lot of womb healing and there's a part of it, the culmination of it is we bless each other as women and we say a prayer and it's, my womb is not a place to store fear or pain. My womb is a place to create and give birth to life.
I love it.
And a lot of it is again about sitting together in ceremony and holding that space and sharing stories and different rituals on how we can integrate and weave this magic into our daily life. As divine feminine, when you're pregnant, you are lit up with life. And as you're emerging into this phase of matrescence, where you're going from maiden to mother, or whether it's, again, just another phase, more powerful phase, having a second or third child of you in motherhood, as we're growing and we're connecting more with that space, we want to be tracking our cycles. We want to be asking the questions. One of the most powerful things had happened to us, had come out of trauma, even for me trying to support one of my children after a trauma, was recognizing that her periods had stopped.
Oh, wow. Really?
And that was my calling. I went and I learned how to do, I deep dove basically into the womb healing that I've dived into. And she was one of the first girls that I started practicing yoni steaming with.
Oh, wow.
And it was powerful and all of that. And it brought her cycle back, but it not just brought her cycle back, it was an opportunity to release the trauma that had happened.
Yes, yeah.
So it's about teaching this to a woman, not just when they're pregnant, but how empowering it is to sit and ask. And, you know, whether it's some form of abuse, or whether it's previous miscarriages,
Right.
or I see a lot of women, they have, maybe it's endometriosis or fibroids. And part of my program is doing the womb healing is sitting and them unraveling what might be the different traumas that happen. And it doesn't have to be, it's a perspective to everybody of
Right.
what a trauma is. But we all have some negative experiences, and we're energetic
Yes.
beings, and we hold that within our wombs so powerfully, using that power positively, but also taking care of ourselves.
Yeah, absolutely. I really think this generation of women who are conceiving and birthing and becoming mothers, I just see them being more open to this. And so I think what you're saying is going to resonate so much with a lot of women.
Thank you.
And
I
so-
hope so.
Right? Yeah. I mean, you've seen it. You've seen it be effective. And just like we said, when we work together, we see energetically, physically, the body lines up, the soul is ready to deliver. And we see these women have improved not only experiences, but outcomes. Which
Absolutely.
Is
I
amazing.
feel so grateful to be in this bubble right now. It feels like
Yeah.
10 years ago when I started, I was still speaking a different language and kind of out there,
Right.
and seeing the growth in the communities and the way that we've evolved is really exciting to see where we're
Yeah.
at right now. And I love that I'm doing birth work at a time where it's become mainstream, this mentality of taking care of ourselves and the nucleus family and the importance of that maternal role.
Yeah, big time. So Jen, these ladies who are like leaning in and tell me more, where can they find out about you?
Birth of a Goddess. Feel free to go on my Instagram, send me a DM, and let's talk.
And you have a beautiful new website. Is it birthofgoddess?
Birthofagoddess.com. Yes.
Yeah, awesome. My friend, thank you so much for being here.
Thank you
I appreciate
so much.
you tremendously.
I appreciate you.
You've taught me so much personally and held that space of mother, sister, friend on so many occasions. So
I love you.
I love you. Thank you for being here.
Thank you.
Take the next step towards a pain-free pregnancy. Schedule your free 15-minute consult at painlesspregnancy.com. Like, share, and subscribe for more empowering episodes.